my name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics. Today I'm joined by David Gervais, the manager of NMC's Diagnostic Imaging Department, and Chelsea Mulheron, who is NMC's new breast care nurse navigator. We're going to talk about Chelsea's work with patients to help them through the process of screening, diagnosis, and the treatment for breast cancer. So thank you both so much for being here today. I really appreciate you being here to talk about breast care and breast cancer. So I mentioned at the opening a breast care nurse navigator. That's a lot. So, so what is that role, and is that new to NMC? So talk a little bit about the role to ground us all.
Sure. The role is new to NMC, but it is not new in breast care in general. Nurse navigators are found across the state, across the country, and really they provide a critical role for patient navigation through the continuum of breast care. When you think about the process of breast care through screening, diagnosis, biopsy, all those procedures that patients have to go through, it can be very confusing, very troubling, very anxiety creating. And having that single point of contact, that person with the clinical knowledge who can help guide you through that system is a really critical role. And that's why we decided to go ahead and implement that at Northwestern Medical Center.
Excellent, thank you, thank you. So Chelsea, this is a new role. So what's your background that prepared you for this role?
I've been a nurse for 9 years, all of which have been at NMC, and I've actually been in the ED, so I've taken care of sick patients through a journey that starts off not so well and ends up with a good ending. So with this journey, I found that I wanted to continue doing that, just with a different population of patients.
And what did fascinate you about even applying for a role, since you were so comfortable in your emergency department role? What sparked your interest?
I just saw the posting and I said, what does a breast care nurse navigator do? I started doing research and I said, this looks very interesting, and with it being a new role that hasn't been implemented, I was very interested in starting something new and developing something.
Great, great. So since it is new, you were starting, fresh, both for you and the department. So, what was it like to get started, in that role?
It continues to be a learning journey for both of us. Yeah. Chelsea and I have become quite a team. We created a job description. We know the basics of what a breast care nurse navigator did or is supposed to do. And we knew that we needed a dynamic person who had the energy and the passion to pour into that role. When we found Chelsea, we knew we had found that person, and Chelsea, you can expand more on that, but really she hit the ground running with the like I said, the passion, the knowledge, the ability to take this role and just blossom it.
Yeah, I was able to jump in, work really well with their mammo lead, Karen Brilson, and start improving things, making patient flow better, what would be best for the patient, and that's really been great. I've had just tremendous support, and everybody's been very on board with making the big process improvements and helping patients.
Excellent. So I'm a patient. Where do you pick me up, and what's the process like? So can you take me through the process?
I can pick you up as early as your initial screening. Like, I found you haven't been for 3 years for initial screening. I may call you and say, hey, Jill, you haven't been here for 3 years for your mammo screening. How about I make you an appointment and we get you to come? And you're like, well, maybe I don't want to go. So patient education right from the beginning, how important this is to start with your screening. So you come in, you get your screening, the radiologist reads your mammography images in 24 hours, and then they decide, well, you need to come back for a couple more pictures. There's some questions on your mammography. So I call you back. I said, one of the radiologists has read your mammography, but they want you to come back for a couple more pictures just to kind of clear things up. Things don't look they look well, but we just want to clear them up. So I usually talk to patients, try to decrease their anxiety, because that usually takes about 5 to 7 days to get them to come in. So that's a long time to think of, oh my, what's on my mammography.
Right.
So I can go over your radiology report with you, answer any questions you have at that point. Or if the next day you've slept on it and you've got more questions, feel free and call me. I just give patients all my number, my email, call me, they can email me with questions. So I see you when you come back for your additional images. At that point, the radiologist gives you your results. Either everything looks fine, we'll see you in 12 months, or I think you've got something, we've got to biopsy it. So if you need the biopsy, I meet with you again. We go over the biopsy, why it's important, what we're going to do, the whole procedure, and I schedule you. At that point, I answer any questions you have, and we schedule you, and those we try to get in less than a week. So you come back for your biopsy. I'm there assisting the radiologist. I'm in the room with you. I go over it again. So I'm once again with the patient. So and then your biopsy results come back in 2 to 5 days. At that point, I will call your primary care doctor and say, hey, you know, Jill's biopsy report's back. If you're positive for breast cancer, so you know, positive for breast cancer, what would you like to do? Do you want to call and talk to her, or would you like me to notify her? And so if the primary notifies you, I usually call within 2 hours after they call and say, hey, I know your doctor's called you. I'm calling because I'd like to set you up with our breast specialist or one of the surgeons and an oncologist, and we'll start this journey together.
Wow.
So
I'm just thinking
that's
about
so impressive.
Absolutely.
You're like right there with me the whole time.
Yeah.
That is so cool.
There are so many opportunities within that whole process that she just described for that patient to have so much anxiety, so much questioning and all this stuff, and having that direct point of contact, having that person you can reach out to, having her right there by your side during that procedure, holding your hand, explaining everything to you, having her call you the day after saying, how's the wound care going? That is such a critical piece for our patients.
Yeah, that's really amazing. So if someone does need surgery or something, do you continue following them? And then and also, could you talk a little bit about what we do in this community, because we must have to partner with UVM Medical Center at some time, maybe, is it for radiation or maybe advanced care? So could you talk a little bit about that partnership? So continue on to the continuum if someone has had surgery?
So usually if they've had surgery, I meet with them. I usually call them 2 days before their surgery. I get an email that patients are having surgery. So I call them 2 days before, make sure they've had their pre-op phone call, see if they have any questions about the surgery, if they need anything at that point. I see them the morning of their surgery. I go in and I pop in and say, hi, how are you doing? What do you need? To chat with them and the family. I have been going in and observing the surgeries, just to help with my knowledge of surgeries and what goes on. And then the next morning, usually they stay overnight at least, the next morning I go in with the oncology social worker. We partner up, we go and see the patient. And that's when the oncology social worker first met the patient. So that was usually the first time these breast cancer patients got to really see any constant staff member would be after surgery. So I've met them a whole month in advance.
Wow.
So we meet with them, and then after that, if they need chemo, Dr. Sanders does chemo here in St. Albans, so that's a couple days a week, and radiation, they would have to go to Burlington for. So we've been working on that at that point. And then for any other testing, we do like I said, we do chemo here in St. Albans, we do all our surgeries here in St. Albans at Northwestern Medical Center. There's just a couple services, some complex breast MRIs that we have to do down at UVM-MC. So I've been able to coordinate those and set up their appointments for those and just make sure they come back and follow up with one of our surgeons here. So that's kind of keeping them here.
Yeah, that really is amazing, and how closely you follow them every step of the way. That's really heartfelt, to have someone walk me through a process like that. So I'm just one person, and there must be more. So how do you manage all of this? Because, not everybody has a cancer diagnosis, of course, but there are a lot of people going through mammograms, and how do you keep track of all of that and make sure women are getting their mammograms?
Well, that's a big process that we're working on right now. I'm working right now closely with Northwestern Primary Care on managing the mammography. So Mel Poirier and I are working closely trying to really map down the list of patients who are due. So they have a great documentation system to be able to pull who's due for mammography. So that's our next big project, to finish doing that.
And Chelsea and I have been reaching out to a lot of the providers in our community. We're still continuing to do that, meeting one-on-one with them, asking what their expectations are of a breast care nurse navigator and what we can do for them to help their patients through that process. So it's not only those practices like Northwestern Primary Care or Georgia Health Center, but also those private primary care offices like St. Albans Primary Care or Cold Hollow Family Practice. all those primary cares are critically important to us, and we want to make sure that we're reaching out to them and providing them with those services.
Excellent, excellent. All right, so how often should we have a mammogram? So what's the read on that?
It can be, it's a topic that can go a couple ways. Traditionally, the American College of Radiology recommends after 40 years old, a mammogram yearly, and folks tend to trend towards that.
Sure.
It's based on your provider preference and what they recommend, but ultimately it's up to our patient's choice.
Sure, sure. So the hospital is part of One Care Vermont and also CHAC. There are ACOs in the area, and we actually look at data that talks about mammograms and other things as well. And I've been so impressed over the past year how we've increased the access to mammography. So I think it's probably through education. I'm sure your role as well is, getting out there and spreading the word and the importance of this preventative screening. So I think that is, hats off to you to really reaching out to women for that screening. So how does this fit into diagnostic imaging? So you have this bigger department, and so how does this fit into your department?
Well, a lot of our patients are women, This is a critical service for our female population, and it's really important to stress that mammography is not only for women. There are men out there who do get breast cancer, and we're perfectly able and willing to screen them as well. The breast care, breast health is becoming so much more prominent in the news and in media nowadays, just through Breast Cancer Awareness Month in October.
Yes.
It's a critical thing that we're trying to expand those services even more and make sure that our community is educated and understands the importance of breast health.
Yeah, great, thank you. So Chelsea, what's next? You're learning this role. You haven't been in it too long. What things are you wanting to improve, and what's your goal here with this program?
Obviously, our goal is to keep patients here. A lot of patients say, I want to stay in St. Albans. I don't want to travel. So our goal is to keep patients here, get them in as quickly as possible to help decrease that anxiety, not having them wait weeks to be seen by a surgeon or to come in for their additional views. So really just continuing to give them excellent care and get them in quicker to get that care completed. That's
Great.
our big goal.
Super. And how do you interact with the radiologists in the department in your role?
I interact with them quite frequently. Anybody who comes back for additional views, the radiologist gives them the results before they leave. So I'm there with them when they get those results, and if they need a biopsy and the radiologist is explaining that to them, I'm right there with them. So that's great.
That's terrific. That's terrific. Well, you have a job that's full of emotion and helping women go through this journey. So what do you do to balance this? Because it must be an emotional drain. You give everything to these patients. I can feel it in your voice. So what do you do to stay healthy so you're ready to guide people through this journey?
Oh, I have two very active children that keep me very busy and on my toes, and I love gardening and just being outside. So that's my healthy, just being outside and gardening, and keeping up with two young kids that's a full-time job on top of this. So it's fun.
So that's a great distraction for you,
yeah,
for sure. That's
is.
for sure. So now, so how long have you been in this role?
2.5 months.
2.5 months?
Maybe 3 months.
So what do you think about the emergency department, where you came from?
I miss certain parts of it, definitely. But this is just an exciting role. I come to work and it's 4 o'clock already. I'm like, where has the day gone? Like, it's amazing how busy I've been. So that's kind of been a good distraction too.
And
So.
2 months in, 2.5 months in, it's amazing the impact she's already had. We've already had feedback in our patient comments that I'm sure you've seen, and I've just seen patients, light up when they see her throughout the process. It's been an amazing journey, and we're very excited for what this holds for us in the future.
That's terrific. That's terrific. Yeah, do you have a memory of a patient that you want to end our time with today about something that really touched you and made, this is the job for me?
Well, we've got David's favorite story. So I have a patient that he tells everybody. So I have a patient who I've been following through the process, and I went to visit her at chemo And so she was just so excited to see me there. I'd brought her just a couple little mints and some chapstick, and she just gave me a big hug, gave her a big hug, and it was just so good to see her there. So not talking on the phone with her, and just gave her a big hug and just to check on her. I mean, I think they just appreciate those little things to be there. So.
They sure do. You know, it's the patient experience, but feeling that warmth and that genuine caring, it makes such a huge difference. So thank you so much for being there for our patients. It's really remarkable.
Thank you.
That position that you're building. So I want to thank you both for being here. This has been a wonderful conversation about breast care nurse navigation and the important role that you play in caring for our community. So thank you both.
Thank you, Jill.
Appreciate that so much.
Thank you.
This
Thank
is
you.
Jill Berry Bowen, your host of the NMC Health Beat Show. Thank you for joining us today.